Goni cervical lateral flexion. Position the patient in sitting with the thoracic and lumbar spine well supported by the back of a chair. Position the cervical spine in 0 degrees of flexion, extension, and rotation. In patient-appropriate language, ask the patient to laterally flex the neck. Assess the shoulder girdle for lateral flexion of the thoracic and lumbar spine. Place your hand on the patient's head at the top and side opposite the direction of the motion. Pull the head toward the shoulder. Stabilize the trunk at the shoulder to prevent lateral trunk flexion. The end of cervical lateral flexion range of motion occurs when resistance is felt and additional motion causes the trunk to laterally flex. Assess the end feel. This is firm because of passive tension in the intertransverse ligaments and the lateral annulus fibrosus fibers, also because of the contralateral longus capitis, longus colli, anterior scalene, and sternocleidomastoid muscles. You're now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the spinous process of the C7 vertebrae. Align the stationary arm with the spinous processes of the thoracic vertebrae so that the arm is perpendicular to the ground. Align the movable arm with the dorsal midline of the head using the occipital protuberance for reference. Ask the patient to perform cervical lateral flexion as done previously, maintaining the goniometer in alignment throughout the entire range of motion, and observe for any extraneous movements of the trunk. Read the degrees of motion on the goniometer and then ask the patient to return the head to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. Average range of motion according to the American Association of Orthopedic Surgeons is 45 degrees.